Hey everyone, this is Keith Scott from out in Sydney, Australia. I'm one of the voices of Bullwinkle J. Moose. It's time to watch Relentless and Unstoppable. And so give it up for your main hosts, Douglas Kenny and Andy McPhee.
Hey everybody, this is Doug Kenny and welcome to Relentless and Unstoppable. We have another amazing guest coming on the channel today, so please hit like and subscribe. And after this episode, please stay tuned to the RNU channel for more amazing guests. Let's get this on!
Hey everybody, how you doing? Just a quick little share of why I started Relentless and Unstoppable. It was for one very simple reason, because of Doug Kenny. Nothing to do with me at all, zero. I was just coaching Doug, and he took on the coaching and mentoring, and he made all the changes. He took all the suggestions from his parents as well as my coaching, but it was all about Doug, his breakthrough and his weight loss, his willingness to accept that he is dealing with high functioning autism and other issues, but he's never quit, he's never given up. So we did one interview with him to share his story, and then we decided to start interviewing other people. And Doug has now taken over the whole channel, and he does all the interviews, he runs everything. He's just an amazing young man. So RNU was born from simply what an amazing young man Doug is, and his story needed to be shared.
Hey everybody, this is Doug Kenny from Relentless and Unstoppable, and today we have a previous guest, Allison Reynolds, with us. Hey, how you doing?
Hey, I'm good, thanks. Thanks.
What have you been up to?
Well, 10 months ago I had a baby, and since then I have been mostly being a new mom, but I also went back to work full time. I'm very blessed that I get to work remotely from home, and so I do get to spend lots of time with my baby still. Like, I took my lunch break today to go to the park with the baby, and she's absolutely amazing. So I've been spending a lot of time doing that. But I've actually had a really hard time, which is kind of what I wanted to talk about, because, on my first episode, I talked about overcoming my back problems, and I had some depression when I was in high school. And then last time I talked about a sexual assault that I had been through. And this time I would love to talk about, because you and I had to reschedule because I've been having such a hard time. So I've had some postpartum depression and anxiety. And after having the baby, it just re-sparked some of that depression. And so I've been really working on that too. I've been doing EMDR therapy for some trauma, for both the sexual assault and then other trauma in my life. And yeah, so I'd love to talk about that today if you're interested.
For sure. So when did you conceive the baby?
So my baby was born November 12th, 2022. So she's just about coming up on 1 year.
Nice, nice. What was the pregnancy like?
Pregnancy was actually great for me. I did very well during pregnancy. And I think part of that is hormonal. There's a pregnancy hormone called progesterone, and it goes way up, and it's a feel-good hormone. And so I did really well. I was eating really healthy. I felt really good. My body dealt well with the pregnancy. I was able to move well. I didn't have a lot of sickness. I had some acid indigestion, especially towards the end. That was very uncomfortable. But I didn't get as sick as I know a lot of mamas get, which I feel was very lucky for me. And I actually really loved being pregnant overall. It was a great experience. And to just imagine this baby growing inside me was pretty miraculous.
Yeah. Did you know whether it was going to be a boy or a girl, or did you wait till you?
We did. We actually found out early. So I'm what they call a geriatric pregnancy, because I'm 36. And so technically if you're above 35, they consider it an older pregnancy. And so you get a lot of blood work done and a lot of tests done. And during that, it's early testing. And during that, you can find out if it's a boy or a girl. And I could not wait. I had to know. So we found out she was a girl pretty early on.
Nice, nice. What were the symptoms of pregnancy that you lived through?
Um, there was some nausea, and mostly acid indigestion, and just getting waddly towards the end. Like there was some back pain, which I struggle with anyway, but that actually got much worse after birth, and after pregnancy. So not a lot of symptoms, to be honest. I felt very blessed and very lucky. My pregnancy was pretty easy.
That's great to hear. It didn't hurt, or did it hurt?
The pregnancy itself did not hurt. I didn't, they have these things called lightning, I guess, where lightning something where if the baby kicks you down in the cervix, it can send shockwaves through your body. And I did have a few of those, and those are pretty uncomfortable. But yeah, my labor was actually pretty difficult. So it was actually a little bit of a traumatic experience for me. So I was planning to have a natural birth at a birth center. I'd been seeing midwives, and I ended up needing to induce because my baby was 2 weeks late. She didn't want to come out, and they only let you go 2 weeks longer than your due date. And so we had to, I had to either choose to go to the hospital or to try inducing naturally at home. So I tried first inducing naturally at home using castor oil. And basically what it does is it like flushes out your system, and it made me pretty sick, but it did start my labor. So it did work. Most moms don't actually have too much issues with the digestive stuff, but I did. It was really, that part was actually really painful going through the castor oil issue. And so my labor started really fast once I took the castor oil. So it like sent me into like pretty strong contractions. And pain isn't the right word for contractions in labor. It's actually intensity. Like there's so much going on in your body, and your body is like really, really experiencing like a dramatic change very quickly. And so it's overwhelming, and it was definitely uncomfortable, but it wasn't like when you break a bone, or like it wasn't a pain like where you're like, oh, this isn't supposed to be happening. It's like, okay, I know this is supposed to be happening, but I was like vomiting and having, everything ran through me. So it was pretty rough while I was having contractions. So that part was pretty tricky. And then I ended up in the hospital because I got something called preeclampsia, where my blood pressure went way up. And so the only cure for preeclampsia really is to have the baby. But they gave me some blood pressure medications in the hospital. And so I had like dilated really quickly, like just in a couple of hours. I went from 0 to 8.5 centimeters, and you have to be at 10 to be fully dilated. And then I got an epidural, and that was hard for me. They said that I needed to have that because my blood pressure was so high, and I was really hoping to not do the epidural just for my own personal reasons, mostly because of my back pain, and I didn't want to be numb through my back. But I didn't go too numb. I still had some feeling in my legs and all that. But then I was in labor for 29 hours because what happened is, even though the first part was really fast, as soon as I got the epidural, my labor slowed dramatically. So I basically stalled out at like 9.5 centimeters, or like almost 10, for like, 12 hours or something like that. So like all day I was in the hospital just having contractions and waiting for baby to come and trying to keep my blood pressure down. And then unfortunately I had a nurse that was like not very communicative, and she was a travel nurse, and she came from a background in ER and trauma. So she wasn't a labor and delivery nurse. She was just working on the labor and delivery floor that night. Or that was her like, travel section or whatever. And so she wasn't very compassionate with childbirth, and I really struggled with that. And she didn't know really how to do consent with touching me. And because of my sexual past, I got really triggered because she basically didn't tell me that she was going to put her fingers inside me. She didn't tell me what she was doing, why she was doing. She didn't ask. And she was actually like, she was trying to help me get more dilated. Maybe this is too graphic. I hope it's not too graphic, but she was trying to help me, and it basically sent me into traumatic response. And so I had a big fallout after the pregnancy. And that I think was one of the things that sparked a little bit of the depression and anxiety. It was like reliving some of my sexual trauma.
Sorry to hear that that happened to you. I had a surgery earlier this year after having 3 weeks or more without anxiety. And once the surgery happened and I lost like some sleep for a bit, the anxiety came back and it took a while for it to go away. I know what that's like.
Yeah. Yeah, it's I think a lot of people live with depression or anxiety and don't talk about it very much. And I think it's great that there's a lot more support for mental health issues, and that and especially for moms after birth, it's actually really common. And they used to just call it the baby blues. But the thing is, a lot of women have pretty substantial postpartum depression and anxiety. And it's really important to get help. And I did support groups. I started my therapy, or I started going to my therapy more often. And it really helped me get through that tough time. I was struggling to breastfeed because of the hormones and all of those things. And I felt a lot of pressure. So I went through a lot of challenges early in after the birth, and it should be, it's this amazing time with this amazing being, but it's also a very, very challenging time. And so, you're not getting much sleep at all. And that definitely, like you said, can increase anxiety and depression. And you're waking up every 2 hours to feed the baby. So it's pretty tough.
What tasks do you do with the baby?
Do you mean now or when she was little?
Both.
Okay, it's very different now. So when she was little, she mostly slept. She ate, slept, and pooped. That's mostly it. And then as she gets a little older, you do tummy time where you lay them on their belly. And my baby had what's called hip dysplasia, where her hips were dislocating. And so we had to have her in this brace that kept her hips in like sort of an outward frog position. And so it made it hard to breastfeed. It added a lot of extra challenges for us. And tummy time was really hard. So we'd lay her on our chests to get that tummy time, and you talk to them and sing to them. And the breastfeeding was like very challenging because I was supplementing with donor breast milk. I was very grateful to get some donations of breast milk since I wasn't producing enough, but I wanted to breastfeed her too. So I was nursing her, supplementing with bottles. I was doing this thing called SNS where you feed them at the breast, but it's actually from the donor milk. And then I was pumping as well to try and increase my supply. And that whole process takes almost an hour, and you feed them about every 2 hours when they're little. So I was basically every hour going through this whole process every day for, several months. And I found out later I shouldn't have been doing, they call this triple feeding, where you're doing the pumping, the breastfeeding, and the supplementing. And it's not sustainable, but nobody ever told me that. So I was trying to survive through doing this for months, and shouldn't have probably let it go on more than a couple weeks.
Yeah, makes sense. I was wondering, what is baby formula? I've heard of it, but I don't know what it is.
Yeah, baby formula is it's basically a type of nutritional supplement that if you can't breastfeed, or if you don't have breast milk, you can give babies that instead of breast milk. Like I said, I was lucky enough to get donor breast milk, which I really wanted to feed my baby breast milk, but I have no judgments. The best thing you can do for your baby is to make sure they get enough food, however you can do that. And so there's a bunch of different formulas out there. Some babies struggle with certain formulas, and they have like with milk-based formulas, so they have soy-based formulas. And a lot of babies do better on formula because they get certain iron and other nutrients that they can add to formulas. But my baby was doing really well on the donor breast milk, so we've just kept her on that. And then, of course, when she was about 6 months old, we started feeding her real food. And so the way she is now is like much different than when she was little. She's eating, she can stand up and kind of hold on to things and cruise around, and she's very active. She crawls all over the place all the time, and she's very inquisitive. She's always pointing at things and babbling. She makes lots of noises, and she can say mama and dada and lots of sounds.
What was their first word?
So there's a debate on this. So babies mimic, right? They mimic sounds. So when she was 2 months old, which is usually too early for developmental language, my dad was like, say grandpa. And she made a sound that was like, ba ba, like it kind of sounded like she was trying to mimic what he said. But we don't count that really as her first word because it's technically too early for developmental language. Her first sound that she did was mama, but we weren't sure if it was like related to me or if she was just making sounds, because she made a lot of sounds. So for sure, her first word that we know like absolutely was dada, because she pointed at her dada and she said dada. And so we were like, okay, that's for sure her. But the funny one is her second word was Batman, because my husband is obsessed with Batman, and we have a Batman doll and action figure and stuff in her room, and we sing her the Batman theme song a lot, which is na 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 Batman, Batman, right, from the 1966 Batman. Anyway, that's the theme song. And so we sing her this all the time. And so she would point at she pointed at her Batman doll, and she just said it over and over again, Batman, Batman, Batman. So it was very cute. And my husband was very excited that her second word was Batman.
That sort of reminds me of something that happened today when I was at the SACE program. Have you been reading my Facebook about SACE?
I haven't been on Facebook lately, actually, no. So you'll have to tell me.
I now go to this autism program where I'm being trained to live independently called SACE. It's the Southwest Autism Center of Excellence, and it's going very good. I'm just about to graduate and then move into a group home this December, so I'm really excited about that. But anyway, we were playing a game called Knowledge. Have you ever heard of Knowledge?
I haven't, no.
It's like Trivial Pursuit, but it's different. And what was fun, this is where it reminds me of similar of your babies of debated first word. I picked up the card and asked I was playing with a staff member and a couple other clients in the program. The staff member's name is Casey. I picked up the card and read out the question, but I read it at such a rapid pace so that it could be hard for him to know what I said. I even mumbled it. I was like, blah, 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 you know. And when he said that, when I did that, Casey looked at me and said, "Can you read it in English now, Doug?"
Yeah, exactly. And I think we have a lot more of that coming. I've spent some time with toddlers, and sometimes it can be very hard to figure out what they're saying. And they believe that they've been so clear with what they've said, but sometimes it's hard to tell what they've said. And actually, now that you mention it, I do remember seeing some pictures of you at your SACE program. I think I don't remember exactly what, but I remember that, and it sounds amazing. And congratulations, that's really incredible.
Thank you. It sort of reminds me of that SpongeBob episode where that guy gives a very vague order to Squidward, and Squidward's like, "We serve food here, sir."
Yeah, exactly.
Gee, that's all we have for Relentless and Unstoppable. So tune into the next episode to hear more amazing stories from amazing guests. This is Keith Scott from Sydney, Australia, saying so long, and I'm smarter than the average bear. Gee.